Hi, I'm Olivia Kramer, and today I'm going to be lecturing about confidentiality. So the book defines confidentiality as the act of limiting disclosure of private matters. The book says that there is a difference between privacy, security, and confidentiality, but today I'm just going to be talking about confidentiality. So the Health Insurance Portability and Probability Act is something that we all have heard of. You may have heard it as HIPAA. It's a set of regulations and rules that tell us how to keep our patient information confidential and what happens if we don't do that. And just, it basically is the core of the nursing profession and confidentiality all in one. So communication and confidentiality are two things that constantly need to be thought of in the healthcare setting. Some risky places to have conversations with other people, with your friends that are coworkers, are hallways, elevators, nurses' stations, lounges, cafeterias, because these are public places and people can be around and hear this information, and it could get back to your patient. So patient information should always be shared behind closed doors only to that patient and approved people that are approved by that patient, such as a spouse or another team of doctors. Some safe zones include the patient rooms with only those people, closed offices, or a meeting room like a doctor's lounge with a group of doctors behind closed doors. So the online world and confidentiality, social media is good and bad, because not only when you're posting things, you cannot post the patient's name, you can't post the patient's face, you can't reveal the medical diagnosis, you cannot reveal any information about that patient. But social media can also be good because, especially in times like this, it helps us keep a connection with our families, our friends, our co-workers, or even those patients that we have grown a bond to. But you should always be conscious of what is being posted, because you never know who can see what, and you never know what information can get back to what people. So texting is also a part of the online world, and it's also a big deal because healthcare providers tend to text each other about patient information and share that information over the phone, which really should be avoided because that information can always be misinterpreted, and you never know who actually is receiving that information in the long run. So for the Qs and competencies, I chose safety, and it's minimizing the risk of harm to patients and providers through both system effectiveness and individual performance. So I chose safety because confidentiality always plays a part in patient safety because of the risk of that patient information getting into the hands of the wrong person if confidentiality is broken. Safety and confidentiality go hand in hand because keeping a patient's information confidential does provide a sense of safety to that patient, and therefore it improves the outcomes for that patient. For the essentials, I chose essential number 6, which is interprofessional communication and collaboration for improving patient health outcomes. The American Association of Colleges of Nursing says that communication and collaboration among healthcare professionals are critical to delivering high quality and safe patient care. I chose essential number 6 because communication is a crucial element in providing patient safety and ensuring positive patient outcomes, like I just said, and safety and confidentiality go hand in hand because without confidentiality, you do not have effective communication. So for the article that I found, it was just sharing a quick tip for confidentiality, and it basically says that upon admission, nurses should obtain the information and verify who can receive specific information about patients, whether it be family members, spouse, only doctors, only healthcare professionals. A nurse should always obtain that information on admission because it's especially helpful for elderly patients who may have many people taking care of them at home, and the nurse doesn't know the daily caregivers from just their family members visiting them in the hospital. So there's a quick tip on just how to maintain patient confidentiality when discussing care with the family members. And here is my reference page. Thank you.